Charge integrity. Assurance that all charges are accurate and represent the care provided with supporting documentation by clinical providers, right? I think we all know that. So, interesting stat down here in the bottom corner. According to the study by the HFMA, the average healthcare organization loses between 2 and 5% of its revenue due to charge inaccuracies. This equates to billions of dollars a year. So let's drill down into some of those strategies that might help mitigate some of those problems we just talked about. So first and foremost, I love the score that looks like the CDM was probably near the bottom, but first and foremost, make sure the CDM is updated and accurate, right? That's the foundation. There are so many problems that can stem from outdated CDMs. Implementing a solid CDM technology and a workflow process will ensure charge codes for procedures, services, pharmacy supplies are accurate and updated timely. Some of the more robust systems that we see out there will actually allow an audit trail to support your financial regulatory agency requirements. It will provide you with utilization reporting, which is really critical, and even give you best practice modeling at a department level. There are also technology solutions to review claims data. Now, this is important, right? So when you reviewing claims data pre or post bill, whatever fits for your organization, looking for charge anomalies. These are safety net tools that are easy to stand up and in most cases have a very favorable ROI. Now, we all know technology is only as good as the team members reviewing the output. These engines can produce a lot of accounts with opportunity that require validation from the medical record to keep the program from drying up. So that's one of the things we see a lot. Folks put in these tools and technology. They don't dedicate the team members to continually work these accounts. It can't be the secondary job. So to keep the program from drying up, the workflow must have dedicated team members. It must have a robust feedback loop to root cause the issues, right? So what's causing these problems? Let's fix it. Is it the HR? Is it one of those items that we just mentioned on the polling question? Let's go back and track the issue so we don't see it over and over again. Let's get it resolved. And track the findings through the rebill and payment process. So you want to track that ROI. You want to see what's actually the opportunity that you've been missing. Education and training activities are best performed by dedicated, skilled revenue integrity professionals. Quarterly and annual sessions are just a few of the must-haves. Another great opportunity we see overlooked is actually to incorporate charge capture and reconciliation activities in your new team member or your department leader orientation. Make it part of their onboarding process. Measuring and taking accountability are critical to any success. You got to measure what you've done, where you came from, where you're at now, where do you need to course correct, and who is taking accountability for that. So you have to have those things in place. Do you have to look for charge anomaly alerts, or are they sent directly to your email? Does your department leader have to go out and find things, run reports, or are these being fed to their inbox with visibility around what the anomaly is? Automate these reports. It minimizes the time to pull the data. It narrows in on the problem areas quickly before things get out of hand. Getting these revenue and usage trends daily at a department level will quickly identify and solve issues almost real time and well before month end. Another thing we've seen is to have charge capture statistics as such as late charge percentages tied to some of the clinical leadership incentives, right? We've seen that. That's been a very healthy solution, and it really gets the clinical leaders engaged and following along with their revenue.